Everyone watches for one thing: memory. You forget a name, you misplace your keys, and your heart skips a beat. You think, is this it? Is this the beginning? But here's what most people don't know, and it's the reason so many families are caught off guard. The earliest signs of dementia are usually not about memory at all. They show up somewhere else first, quietly, in your mood, your senses, your habits, sometimes years, even a full decade before a single memory problem appears. By the time forgetting starts, the disease may have been changing the brain for a long time. I'm Dr. Victor Cole, and in the next few minutes, I'm going to walk you through 5 early warning signs that have nothing to do with forgetting. Some of these will surprise you. And stay with me, because the 5th one is the one people brush off the most, and it may be the most important of all. Now, before we begin, I want you to take a breath, because here is the good news, and it's real. Some of the causes behind these signs are treatable. Some are even fully reversible. The whole point of catching things early is that early is when you have the most power to act. So this isn't a video about fear. It's a video about paying attention. Let's start. The first sign is a loss of interest. Doctors call it apathy, and it's one of the most common early changes, yet it's almost never recognized for what it is. Here's what it looks like in daily life. A man who loved fishing every weekend just stops going. Not because he can't, but because he doesn't feel like it. A woman who always called her grandchildren now lets the phone sit. Hobbies fade. The garden goes untended. The newspaper stays folded. And the person often doesn't seem bothered by it, which is exactly why families miss it. They think he's just getting older, or she's slowing down. But true apathy is different from being tired or being sad. It's a flatness. A loss of drive. Why does this happen in the brain? Because some forms of dementia begin in the frontal lobe, the part of the brain that generates motivation and initiative. When those circuits start to weaken, the spark to start things just dims. The desire goes quiet before the memory does. When should you talk to a doctor? When the loss of interest lasts more than a few weeks, when it's a clear change from how the person used to be, and when it doesn't lift even with the things that used to bring joy. And I'll say this, apathy can also come from depression or a thyroid problem, both of which are treatable. That's why you check, you don't assume. The second sign lives in a place you'd never think to look. Your nose, a loss of smell. This one stuns people, but the science is strong and it's been known for years. Many people in the very early stages of certain dementias begin to lose their sense of smell long before anything else goes wrong. Here's what it looks like. Coffee doesn't smell like much anymore. Flowers seem faint. You can't tell when food has gone bad, or you stop noticing the smell of cooking. Often the person doesn't even realize it's fading because smell slips away slowly and quietly. Why does this happen? Because the olfactory system, the part of the brain that processes smell, sits right next to and connects with the regions where diseases like Alzheimer's and Parkinson's often take hold first. The damage can reach the smell centers before it reaches anywhere else, so a fading nose can be an early messenger. Now please hear me clearly. A lost sense of smell does not mean you have dementia. Sinus infections, allergies, certain medications, and yes, we all remember, viral infections can all dull your smell. Most of the time it's something simple, but if your sense of smell fades gradually, with no cold, no congestion, no clear reason, and it doesn't come back, that's worth mentioning to your doctor. It's a simple thing to test, and it tells us something. The third sign is trouble finding words, and I want to be careful here, because this is not the same as forgetting. We all blank on a name now and then. That's normal. That happens to me, and it happens to you. This is different. It's the moment in the middle of a sentence when a common word just won't come. Not the name of a person, but an everyday word. You point at the clock and call it the thing on the wall. You ask someone to pass the thing. The word for fork or watch or chair simply isn't there. The thought is whole. The idea is clear. But the label is missing. Conversations start to slow down. The person may talk less to avoid the struggle. Why does this happen? Because language lives in specific networks in the brain, often on the left side, and when those connections begin to fray, retrieving words gets harder. It's not that the memory of the word is gone, it's that the path to reach it is breaking down. When should you act? When word-finding trouble becomes frequent, when it's clearly worse than it was a year ago, and especially when it starts affecting conversation or work. Because here too, there are reversible causes. Stress, poor sleep, certain medications, even low vitamin B12 can muddy your words. And that brings us to a question I want you to hold on to, because we'll come back to it. How do you tell the normal slips of aging from the early signs that matter? Keep that in mind. The answer is coming. The fourth sign is getting lost. Trouble with direction and space. This is one of the earliest and most telling changes, and it's deeply practical. Here's what it looks like. You're driving a route you've taken 1,000 times, and suddenly, for a moment, you don't know where you are. You feel turned around in a parking lot. You struggle to follow directions you used to know by heart. In your own neighborhood, something feels unfamiliar. People often describe a flash of panic, a sense of, wait, where am I? Why does this happen? Because deep in the brain sits a structure called the hippocampus, and nearby regions that act like your internal GPS. They build your mental map of the world. These areas are among the very first that Alzheimer's disease attacks. So before names slip, before stories blur, the inner map can start to smudge. When should you talk to a doctor? When getting lost happens in familiar places, when it happens more than once, and when it comes with that feeling of confusion about where you are or how you got there. This is one I never want you to ignore, both for safety and because of what it can tell us early. And now the fifth sign, the one people explain away more than any other, changes in personality, mood, and judgment. This is the sign that gets blamed on everything else. Stress, age, a bad mood, a rough patch. But a real shift in who someone is can be one of the loudest early signals of all. What does it look like? A gentle person becomes irritable or suspicious. A careful, private person says blunt things they never would have said. Someone who always handled the bills makes a strange financial decision, falls for a scam, gives money away, or pays the same bill 3 times. Good judgment slips. There may be new anxiety, new fearfulness, or a flat, withdrawn quietness. And very often the person pulls back from friends, stops going to church, drops out of the card game, withdraws from the world. Why does this happen? Because the frontal lobes right behind your forehead are the seat of personality, self-control, and judgment. When disease begins there, the changes show up not in what you remember, but in how you behave and how you decide. The brain that weighs risk and reads situations starts to falter. When should you act? When there's a clear, lasting change in personality. When judgment around money or safety starts slipping, or when someone you love is quietly disappearing from the life they used to live. Don't wait this one out. So let's return to the question I asked you to hold. How do you tell normal aging from a warning sign? Here's the simplest answer I can give you. Normal aging is occasional, it's mild, and it doesn't stop you from living your life. A warning sign is a pattern. It's persistent. It's a real change from how you used to be, and it's starting to affect daily life. One forgotten word is nothing. A new steady struggle that wasn't there a year ago across any of these 5 areas, that's worth a conversation. Not panic, a conversation. And I want to leave you with hope, because it's earned. Many of the things that mimic these signs are reversible. Thyroid problems, vitamin B12 deficiency, depression, sleep disorders like sleep apnea, medication side effects, even dehydration in older adults. Every one of these can cause memory, mood, or thinking changes, and every one of these can be treated. That is exactly why you go in early. You may walk out with answers that are simple and fixable, and even when it's something more serious, early is when treatment, planning, and support do the most good. Early is power, so here's what I'm asking you to do. If you recognize yourself or someone you love in even one of these 5 signs, don't sit with it alone. Write it down, make the appointment, bring this list to your doctor and say, I want to talk about these. That single step can change everything. If this helped you see something you hadn't noticed before, do me a favor. Subscribe to the channel and share this with someone you care about, because the person who needs to hear it may not be watching. They may be sitting right next to you. One last thing, and it matters. This video is for education, not medical advice. I can't diagnose anyone through a screen. Please talk to your own doctor about your health, your symptoms, and any changes you've noticed. They know you, and they're your best partner in this. Take care of your brain, pay attention, and I'll see you in the next one.